a lot about the HPV virus and the vaccine designed to prevent it, but there's been a lot of controversy along the way. Dr. Angela DeRosa is here this morning to dispel some of the rumors and give us the facts on this very important matter. Welcome back.
Thank you.
This is our first time meeting.
I know,
so
it's fabulous.
You are a delight. Thank you so much. For folks who may not have heard about this, HPV is, of course, the human papillomavirus. It's spread through intercourse and other sexual activity, right?
Correct.
Explain to folks what it does in the body.
Well, the HPV virus is a virus that, as you said, can be transmitted sexually, either through genital contact or intercourse. But what's interesting about it is that it has two ways it can go. Number one, if it's a certain variant, it can create genital warts, which are visible, but unfortunately, the more virulent type can also cause cervical cancer.
Right.
And both men and women carry the virus, and about 75% of us within 2 to 3 years of our first sexual contact are going to have that virus. And we screen women all the time for this with our pap smears, but for men, we don't screen them at all. And they're the big carriers of this.
Yeah. It's interesting because this vaccine that is new can stop cervical cancer. So you got to wonder, why is it so controversial that, you know, these young girls get it or not?
Well, not only young girls, but we're now advocating that boys get the vaccine so that they're not carrying it and spreading it. We'd often think of that if we give the vaccine, that we're giving children the permission to go ahead and have sexual contact.
Right.
But I often think about it this way. So if you're, as a parent, knew that down the road, if your child was going to have sun exposure and you could give them a vaccine to prevent skin cancer, you know that at some point they're going to have that sun exposure and they may use sunscreen or protection, but they could still develop the cancer.
Right.
Why wouldn't you do that for your child?
I don't understand
This is not a caveat or permission to have sex, but it's for the future potential protection of cervical cancer prevention.
Right, and we keep saying young girls and young boys because those are the only people who can get the vaccine. It's new. Kind of talk about who can get it.
Yeah, the vaccine is designed from ages 9 to 26, but we often suggest that 11, 12 is the ideal time. You really want to get those vaccines in before they have any sexual contact.
Right.
However, with that said, if they've had some sexual contact in the future, you can still have the vaccine if you're before the age of 27 because you may not have developed the variant of the HPV virus that would cause the cervical cancer. So it's really, really important to get it before my mom would always say, the cow has left the barn.
I like it.
But anytime is okay.
Yeah, it's very important. What is the biggest myth you think surrounding this vaccine right now?
Well, a lot of people talk about vaccines and autism, and they worry that if you vaccinate your children that they're going to become autistic. The jury's still out on that. There's a lot of celebrities that are pushing that, and unfortunately they've gotten a very loud voice. But the true data doesn't suggest that.
Right.
It certainly maybe when you're younger, newborns are getting all these vaccines and all these toxins introduced to their bodies. That may be more of an issue, but we're talking people or young children who have not had vaccines in a long period of time, and there's really little risk of that developing.
Sounds like you advocate it. You say yes.
Oh, if I don't have children, but if I had a daughter or even a young son, I would absolutely give this, because not only can we prevent them from having cervical cancer as women, but we also prevent the transmissions to other people too.
Well put. Thank you very much. You're going to leave it right there. Dr. Angela DeRosa, thank you again.
It's so wonderful meeting you.
You too. We're going to take a quick break. We'll be right back.